Okay, welcome back all. We are here for our final session today, and I promise it will be equally brilliant. And we're calling this our Policy and Practice Roundtable. So our moderator today is Jason Sendes, who is a nationally recognized world expert, family policy expert and advocate dedicated to transforming how America values care. And he is the president and CEO of the National Alliance for Caregiving, and is just at the forefront of driving research, policy, and systemic change initiatives. With that, I will let Jason take over and introduce the panel.
Great. Great. Thank you so much, Dr. Ornstein and Dr. Fabius, for creating this space and helping to build this bridge between these two really interconnected communities. Long overdue to put a spotlight on the interconnected realities that family caregivers and direct care workers face. Really excited to be in the conversation. I'm going to invite my fellow panelists up to the stage. Wendy Fox-Grage, Nikisha Knight-Cole, May Pham, and May Red Painter to join me up here. Excited to really explore this issue further, continue to strengthen that bridge that's being built all day today, and really think about where policy starts to turn into practice, the realities shaping the communities that we've talked about and heard from today throughout the panels and also in the comments between the panels. So grateful to share a stage with these amazing women who are working to shape how we value care across the country, particularly how we value that relationship between direct care workers and family caregivers. And so that I'll ask each of our panelists on stage to introduce themselves and to also offer a reflection on our first question, which is, if shared care were working well today, what would long-term care look like in this country? So I'll start with you, Wendy.
Hi, everyone. I'm Wendy Fox-Grage, and I work for an organization called the National Academy for State Health Policy. And we work with state health policymakers, so legislators, state aging disability directors, Medicaid, folks at the state level. I'm also the director within my organization. I'm the director of the Raise Family Caregiver Center. There would be three things I would focus on in order to answer that question. One is I would have it be easier that direct care workers and families could find each other. So I am a big girl fan of these matching registries. So according to the PHI research by Kezia and Amy in the room, there are 11 registries that are statewide. So we can do a lot better, but we know how to do it. So let's get going, right? The second thing is, and you've heard a lot about this today, I would ask family caregivers and direct care workers what they need. That often does not happen because the focus, and even their focus, is on the person needing the care, the patient or the person receiving the care. But there are a lot of touch points along the way within the healthcare system, if there's Medicaid, where the patient is being assessed, but the family caregiver and the worker are never asked what they actually need. So I think there's lots of built-in opportunities there as well. Then that's where you can hook them up to whatever it is they need, whether that be training. And I love Robin's idea of training together, lots of efficiencies there. I'm reminded of having a very early on discussion with a state administrator who I really respect in Washington State. And these were early days. And she said, Wendy, if we can reach them sooner, way earlier in the process, oftentimes what they need is a game plan so that they know what's coming next. And you can resolve a lot of the issues way earlier on. So that would be my second. And then third is once you ask them what they need, that they actually get. They get the services they need, and they're not on any kind of a wait list or waiting for that. With that, I'll pass on to our next panelist.
Thank you, Wendy. Green light.
Good afternoon, everyone. My name is Dr. Nikisha Knight-Coyle, and I am visiting from the state of Oregon. I'm the director of the Office of Aging and People with Disabilities that's housed within the Oregon Department of Human Services. Just to give you a sense of the perspective that I bring to this panel, under my purview, we've got Medicaid monitoring services and supports. We have Older Americans Act programs and services there. We've got licensing and regulatory oversight and adult protective services. We also have a home care commission, and we do disability determinations for the state as well. And there's a lot to unpack, so that's the highest level that I can offer it to you all. Super excited to be on this panel. When I think about if things were working, our workers would feel honored in this work, and we would respect the work that our workers do. Direct care work is hard. It's thankless. And one of the things I didn't mention is that my dissertation looked at the experiences of Black women direct care workers in long-term care. We have to reconcile with the fact that a lot of what we see with this workforce, it stems from a dark history in our country that makes it okay for women of color and immigrants to be treated poorly. And so when I think about what could work well, we have to reconcile with some of that darkness in order to bring us into the light. And what excites me about these conversations is the opportunity to sit with others of like minds. And we're all passionate about this work. I'm going to stop there.
Thank you.
It's really an honor to be here. I'm Mai Fan. I founded and lead a nonprofit called the Institute for Exceptional Care that is focused on making healthcare better for people with intellectual and developmental disabilities. I'm also an immigrant, and I was in the sandwich generation because I have a 23-year-old autistic young adult living with us, and put my mom to rest a year and a half ago. And I'm going to play against type today. Usually I am the hard-eyed, cynic, technical gal in the room, but having heard the whole day, I'm actually tempted to pull us all back to try to paint a different big picture that pulls together several threads I've heard to, as we now like to say, feed several birds with one stone. So, for example, I heard about how it takes a village. I heard about the importance just in that last wonderful video about the importance of feeling connected and not isolated. I heard about how no one person can do everything, and in all likelihood, no two people can do everything. I heard about how unresponsive government has been, and about how we're all tired of waiting. And I heard about lack of respect, which is really coming from so many places. But part of it is that the people we haven't reached don't see themselves in these scenarios. And so there's a lack of empathy. So imagine this. Imagine if it was actually a village. I'm still related to half of Vietnam, even though we emigrated in 1975. And when we went back 20, 30 years ago to visit my oldest aunt, it was in a tiny rural village in the north. And I sat here and I thought about her as everyone else was talking, because I realized I didn't have to worry about home care for her. She had an actual village. Now, it helps that she was related to a lot of those people, but I don't think that accounts for all of it. I think what the gold rubric contraption that we've been working in, right, all this jujitsuing, is all about trying to recreate something we've lost. which is the actual village. And so maybe the big picture opportunity here is to imagine what that real concrete modern village could look like. So I'll give you an example. I live 20 blocks east of here, and there are two organizations in that Capitol Hill village that have been really important in my life. The first was a group called Moms on the Hill, MOPS. There were lots of dads, but it was the moms that started it, right? And then the other group is Capitol Hill Village. So Moms on the Hill started as a group of urban warriors who had little kids in a neighborhood that at the time was like really pretty dicey from a crime perspective. And schools were not great, all kinds of things. And, you know, over time, it's become not just a sport where there were play groups you could sign up for, rockers and rollers, wobblers and shakers, movers and shakers, you know, for the size of your kids and how developmentally advanced they were. But it also provided play dates, and it also provided a place to exchange advice, exchange actual things, exchange respite care, and to actually help people wend their way through early parenthood. And then it became the nidus for many other tendrils reaching out into the Capitol Hill village, right? The soccer league, the after school programs, whatever it was. It's not that Moss drove that all, but the expectation that in a cold, you know, cynical urban neighborhood, you could have community, that just changed everyone's mindset. The other organization is Capitol Hill Village, which there are many villages across the country. They are nonprofits committed to helping older people age in place. And Capitol Hill Village is particularly large, and I believe it's the oldest one. And I had known about it because a friend of mine runs it, but we didn't interact with it until we were looking for places for my autistic child, Alex, to volunteer. And it occurred to me, hey, maybe there are volunteer opportunities for Capitol Hill Village, and indeed there were. And through that, we have now, you know, committed to making meals once a week for 3 different households. And that means that we go and see them every week. We see how they live. Whether there's a call for random things like someone needs medication picked up or a ride to a clinical appointment, different volunteers chime in. Sometimes the members in the village are also volunteers because they see that their needs are going to come and they want to pay it forward, basically. But again, just, you know, another nidus for shifting the mindset in this it's a racially and economically diverse neighborhood, which is, you know, rare in DC. And so to have the experience of going to the home of a blue-haired, genteel white lady, and then to Capitol Hill Towers, where lots of older single Black men and women live, it's in my same neighborhood. It gives me a very different sense of what I'm accountable for and whom I can support. So now imagine enlarging that and doing it in a systematic way, but not in a prescribed way or a top-down way, where there's some sort of common consensus around, okay, what's actually the taxonomy of caregiving? What are the different functions? Everyone's going to need different combinations of them, but what are they? And then what resources does our village have to address these various functions? And then, and only then, if it's necessary, should we bring in government? Because I got to tell you, right now, I am not in the mood to wait for government to lead. Like, I will be thrilled if they're willing to just follow. I think it's up to us to own that agency, especially for a problem that is so not just complicated, but ancient. This is an ancient problem, and there is much grandmother wisdom that we know in our bones, but we haven't tapped into. I know I didn't sound anything like a policy launch.
Yeah, brilliant. No one's coming to save us. So thank you, Mai. Over to you, Mayra.
Hi, so I'm Marie Painter. I'm the state long-term care ombudsman in Connecticut. And so I'm going to come at this from an ombudsman point of view. which is a little different sometimes when we're talking about policy, because we're talking about what matters most to the person and how they're experiencing it, and also the individuals who support them. And I would actually like to go back 25 years. So when I first started, actually 30 years ago, started in long-term care, the company that I worked for was just starting with culture change. And we were really invested in getting to know the individuals that we were serving, not focusing on calling them residents. No one calls me a house dweller. You know what I mean? Talking about people. We're caring for people. We're caring for people in a home. We moved away from calling it a facility. I've actually gone back to calling them in places facilities, and I've said in Connecticut that I won't call them a nursing home until they start to look and feel like a nursing home. I want to take that step back. I want to have the ability for the individuals who are owning and running the nursing homes in our community to actually live in our communities, have to look at the people they're serving at the grocery store when they're getting their groceries. And we saw really good care. When you have caregivers that are caring for people in the community that they're bonded to, that they go to faith-based services with, you get really good outcomes. We also had the opportunity then, we all wanted that sticker, JACO approved on our door, and it mattered, right? You worked to the highest potential because you wanted to be the nursing home that people wanted to come to. We had really long wait lists because we had really good reputations. And when the payment systems changed, we really saw a change in those priorities, a change in how do you get short-term people in. Doesn't really matter about the long-term people anymore, right? And we shifted who we were caring for, and we started labeling people. You're a long-term resident. Right? What unit you worked on changed. Who your partners were in the nursing home. Care plan meetings went to 15 minutes. You better hurry up and you better be in here at 2:30 because you're scheduled 2:30 to 2:45. And if not, you're gonna have to wait a quarter to really talk about your care needs and what we're really here to do. So I'd actually like to find a way to go back to some of that and actually have a public sort of cry out to say, no, these are public dollars in a lot of cases. And we deserve to have the time. We deserve to have the housekeeper from the unit at the care plan meeting because they actually can speak to my loved one in their language of origin, and they have a great connection, and they know that she likes tea first thing in the morning. Understanding residents' goals and priorities, and how does the family caregiver or the friend relate into that? Maybe my best day is when one of my kids or my best friend gets to come and visit me, or I get to take the bus from the local community and go back to the senior center for book club. We had one resident that really wanted to do that. Those are the things that matter, and I think for me, it would be great if we could get back there.
Love that. Great reminder that policy change is necessary but not sufficient to tackle, I don't know the way you put it, Maya, these ancient problems and also opportunities to do better for those in our lives. So I want to hone in a little bit on that as part of the next part of the conversation. You know, the policies that are most promising for supporting shared care, but maybe that we're struggling with implementation, and also some of the issues that are most concerning that you're seeing play out in states and communities. So I want to start with you, Dr. Nycoyle, and then we can open it up for others.
Oh, thank you. The question of what's concerning. So, so in the position that I sit in, budgets are low and strained, and tough decisions are being made about where to direct very limited resources. And that's top of mind for me every day. You know, it impacts staffing. If you don't have the staffing, then it's hard to do the work in a way that's timely and that ensures a level of quality. And so as you can imagine, the customers within my system are vast, right? So my customers include my internal team. It includes our providers, right? It includes our workforce. And then ultimately, it includes our consumers. And in Oregon, we use the term consumers. We use patients. We use lots of different terms. I use consumers because that's what they've asked to be referred to. So when you hear me say that, that's kind of what I'm speaking to. So lots of challenges given that budget. One of the things I'd love to also share that's top of mind but also relates to the workforce, but I'm going to take you on a little path to get there. Some of the demographic shifts that we're seeing in this country, okay, with the growing number of individuals who are age 65 and over, and that number exceeding those who are aged 18 and under, have great implications for our workforce. Younger people are having smaller families. They're not having as many children. So when we think about how we are preparing for a workforce that we're already struggling, right, to retain the level that we need, I'm thinking about the years ahead and how do we prepare. I'm thinking about, do we have the tools currently that will enable us to be prepared when this time comes, okay? I'm thinking about a smaller workforce, right? And with that smaller workforce, there's going to be greater competition across all sectors. What does that mean for our sector? Okay. I'm thinking about, in Oregon, the 740,000 caregivers, family caregivers, that are providing 347,000 hours of care annually in Oregon. Smaller families means we're not going to be able to rely on those supports in the home. So as I'm thinking about what I think about every day is, how do we ensure that we're doing everything that we can today in preparation for tomorrow, and that we're doing it as we're working through our budget constraints, as we're working through the day-to-day, right, challenges that we all have inevitably in our work, that it has to remain a focus. So one of the things that I'm doing is I've convened what I'm calling an aging and disabilities symposium and a forum for people who are all partners, interested parties, providers, consumers, workers, the like, to come together and to come up with priorities for our system. Okay. And the first symposium resulted in the identification of 5 top priorities for us. We have the second one coming up, and the focus is on workforce, because that was the number 1 priority that came up. And with this, I have maybe a dubious plan for why I'm pulling these individuals together. Operating as a public servant within that sphere means that there are times when I can speak openly about budget, and there are times when I cannot. So if I can get a group of partners to come, interested parties, to sit and think through what the priorities are of our system, then we can all map out, when can I carry the water? And when will I have to turn to the group to carry the water? We're going to have to, in order to navigate the spaces that we're in right now and what's coming, we're going to have to be creative in how we're engaging and what that looks like. And so maybe for the next meeting, I'll have some updates on how the second symposium works, but it's critical. And that's just our sector. So there's a lot more questions and concerns that I have than what I have answers to, obviously, or plans for. But I would love, I know we'll have a few minutes maybe toward the end to hear from some of you, like, what are you doing? How are you all preparing in your states and in your spheres of work and influence for what's coming? Okay. And then at the same time, someone mentioned ageism earlier, and I just about fell out of my seat because we all navigate it, right? But we don't necessarily speak about it. Okay. And when I have to make the case to go out to our legislature and speak about what's happening and to get that interest, and it's challenging. It is challenging, but it's so critical. Someone was talking earlier, a few of you all were talking earlier about going out and bringing them out to facilities, bringing them out to homes so that they can actually see the work. We're doing that too. Anything that we can do, particularly for those who are making funding decisions for our budgets and for our work, it is irresponsible for that to happen without the awareness of what it is they're indeed funding and what those potential implications are of not funding it. So thank you.
Excellent. No, I love that. Those are great examples of really concrete opportunities to build support, and also the coalitions that were talked about earlier, right? Sort of really thinking about breaking down silos between aging and disability. It sounds like you're also welcoming in, both stakeholders from both sides of the direct care workforce, the family care providers, and then also, most importantly, or just as importantly, at least for the funding perspective, the policymakers making these decisions to see for themselves. I think that's a great example of something that could be scaled across different states. I open up for others examples of either policies or practice change that you see are working for advancing shared care at states or in systems. Mayra.
I have two. One that I think is a promising, and one where I think we need further implementation and support. The one that I think we need further implementation, we talked about AI earlier, and I think when people hear technology, that's the first place people's heads go today. But I think with the funds that we put into our long-term care centers, we are missing the opportunity to have technology that can support both the workers that are there and the individuals who are receiving care. Think about the lifts, right? Automatic lifts where people wouldn't be exhausted, their backs wouldn't kill them after working so hard. There would give independence to individuals to be able to move themselves around in bed, to stay in the bathroom by themselves so the caregiver could go take care of someone else. And have that person remain safe and not end up on the floor. And looking at those dollars that go into buildings and how are we requiring that they're being used to help best support the people who work and live there to have good quality of life. I think we didn't recognize prior to COVID, or many people didn't recognize the value of the caregivers who were doing it previously in the greater community, but then supporting their loved ones and friends in the nursing homes until they were barred from going in. And when we barred people from going in and having the opportunity to support people in their care and long-term care settings during COVID, we recognized how much free care is done by family and friends to support caregivers. And it was actually the nursing home staff that really started reaching out to my office first, saying, you need to let the family members in. Individuals living here are dying, not because of COVID, because the lack of interaction with their ongoing support system. Support doesn't stop because you have a loved one that goes into a long-term care setting, right? You're going to appointments, you may be stopping in to help them eat at night or put them into bed, or just the social interaction alone. None of us can live without it. And I think we identified a lot of that during that period. And some states have passed an essential caregivers bill, but the ones that didn't were really encouraging it. And now there's a federal bill that was brought by first Congresswoman Kenny and Congressman Larson, and now Senator Blumenthal and Senator Cronin in Texas, and it's bipartisan. Why this hasn't passed and why it isn't something we can't get across the finish line when we've really demonstrated that everyone, no matter who you are, we're all aging, we want to age well, and we want to have the access to the people that matter most to us. So that's one I think we could get across the finish line, and a way that we could prioritize accountability for funds so that they really go to better care outcomes and better support for caregivers.
Wonderful. Maya, anything to add in terms of promising policies?
So I'm not an expert in the caregiver-focused state policies, but I guess I would ask, are there lessons that we can learn from other sectors that have faced or are facing similar workforce challenges? So, for example, K through 12 education. Right? So I wonder about creatively leveraging structures that are already there, but adapting them for these needs. So for example, why can't AmeriCorps people help with shared care? If there are many employee interest groups, many of them are focused on disability. We have found that they are quite eager to volunteer. Think about it as like the shared care equivalent of, a food bank or a place that, like, a structure for contributing that becomes familiar enough to people. It's just a matter of finding enough bodies. Of course, they need to be trained, and I don't mean to devalue the expertise that direct care personnel have. But as I said, there are many things, like we would want them to practice at the top of their license, just like everybody else. They don't need to be the ones running to the pharmacy to pick up the medicine, right? They don't need to be the one figuring out how to get into this portal or fix that device or whatever it is, or finding the plumber. What are the other things that can be taken off their plate so that they have that? And then, yes, at a different level of training, respite services and things like that. So again, just kind of like really tapping into what we already have out there and just claiming a little bit of it for this.
I love that. I think that connects to something that you said, Myla read about, the intersection between these issues and policy areas that we don't often talk about, housing, zoning. I think about something that you just said, Mai, and the opportunity to look at not just K through 12 education, but some opportunities in that, like co-located care, and how there are things like zoning laws that stand in the way of thinking about co-located care. So I think we have to think outside the box in order to create opportunities for care to meet people where they are. And there are 16 million Americans providing care for children while they're providing care for older adults or people with a serious illness or disability. How do we create systems that recognize and integrate them into communities? And so I want to talk a little bit about, before we open it up for questions from the audience, a lot of folks in the room and online are really thinking about how to start this or advance this conversation in their states. If a state wanted to prioritize shared care tomorrow, where should they start? And I'd love to start with you, Wendy, because you're talking with leaders from states every day. What are you hearing from states in terms of where they're making these investments and innovating?
So I'm going to draw on my experience. Right now, we're running a learning collaborative. We're 13 states that prioritized caregiving have been in it'll be a 1.5-year program where they all learn from each other and they set actions and priorities. They will apply, by the way, to be in this learning collaborative, and they had to have high levels of state leadership among the state officials who were participating. And again, 13 states. So that kind of tells you something right there. We were actually surprised with the high numbers of states because they had to have leadership buy-in for this. So I think there's a lot of if state leaders see, I'm sitting next to one, right? They see this, they live it, right? They breathe it. But I've got to be honest. I think where they're starting right now is with low cost or no cost solutions. And because of the budgetary pressures that they are under right now. But you can do a lot with that. They are doing a lot with that. And you've heard some of this. There's promising practices, by the way, in every state. The issue is scaling up and replicating. It really depends where you live, right? So we have this, right? We have promising practices. So let me just point out a few opportunities within kind of the low cost, right? And I do think there are a lot of advocates. You can think of this about having kind of, short-term solutions, kind of mid-term solutions, and then long-term solutions. But so here's some things that they're working on right now. They know that oftentimes caregivers don't know where to turn for help or where to turn for services. Marketing, that is something you can do right off the bat. We created with them a whole array of marketing tools that any caregiver program, any state can take them on supportcaregiving.org. It's a website that we're involved in with lots of partners. They can take these ready-made flyers, put their own colors, their logo, and, modify it slightly. And those flyers can be in doctor's offices, they can be wherever. A pharmacist can staple it onto the prescription. Same with posters. They can take this, and by the way, the Johnny Hartford Foundation funded it. So it's for free to everybody that they can use. So anybody in any kind of program that wants to get the word out, these materials are out there, along with sample press releases and so forth. We're also very interested in going back to, well, what do we know? How can we find out with these caregivers on both sides? What do they really need? Here, that's a fancy word for that is, what is the caregiver assessment? That's a fancy word for saying, what questions are you asking, right? That gets you data, by the way, too, is if they're all using the same assessment tool. They're all different kinds of services, and you heard the wide variety of them and how they're funded. So it makes sense that when you have a caregiver, you're asking what they need, you ask it in a standardized way, and that gives you back to the earlier panel, how do you get data? How do we know who's doing this? Well, that's a way to do it. And that is a lower cost item as well. There was recently, all 50 states applied for these rural health transformation grants. Every single state. And guess what? Aging was not supposed to be, or caregiving was not supposed to be in it, but 33 of the applications have initiatives. 33 of those applications have initiatives addressing the workforce as it relates to caring for people in long-term care settings, home, nursing homes, and dealing with the workforce in particular and direct care workers. So that to me is reflective of what you're saying, in particular with rural health communities. Respite care, which we've not talked about. I know we're on time. Okay, there are quite a lot of variety of things. But even with those high dollar amounts, right, that it might not be right now, there are states that all have state aging plans. Many states are increasingly adopting what's called a multi-sector plan on aging. Those are opportunities to get these ideas that it might not happen today, it might not happen tomorrow, but those multi-sector plans on aging are 10-year plans, and you want to get it into that document. And then the one last thing, how many of you all know about the national strategy to support family caregivers? Oh, yay, we have some. That is an opportunity. So it's a big national plan. It's a congressional. It goes to Congress, right? In fact, we have members in the audience who are on part of that phrase council. They are right now updating that plan. They're meeting, the full council meetings are live streamed. They have one coming up at the end of this month. And the biggest thing that they are deliberating on right now, and these are from councils on family caregiving, they are deliberating right now about updating and having a focus on the direct care workforce. That is progress.
We're gonna have to look at you to tell you what you need to cut down. One of the great things about the national strategy is also a menu of opportunities for states to integrate actions to support family caregivers. And while the direct care workforce aspect is not yet a sixth concrete goal, direct care workforce is integrated across the strategy. So there are still opportunities to think about how to integrate them into multi-state plans. I want to, for our last comment before we open it up to questions, I want to turn back to you, Dr. Knight Coyle. If another state leader, someone in your position in another state came to you and said, I really want to take on this issue of shared care, where would you turn them?
Thank you. I would collaborate with them. I don't know that we're doing the very best that we can in this area. I think there are many opportunities, given the structure of the system I described to you all, that operates in Oregon. And I would say that there's just a lot of opportunities to pull the pieces together with intention. So look, again, like we're in licensed care, right? We're in home care, right? We're writing the policies, right, that influence. So I think there are many opportunities for us to strengthen. And I just have to say, if I may, listening to the discussions earlier today has been very, very inspiring. to me. And I think I was talking to some of my seating neighbors over here about my intention to really go back and look at how well we're doing with our family caregivers, to what extent we're engaging. And even with regards to our home care workers, we're doing all of this work, and sometimes we might be doing the work around them rather than doing the work with them. And so one of my takeaways from the discussions earlier today, and one of the commitments that I had, because I always like to have commitments when I leave events like this, like, well, okay, what are you going to do? And one of the things that I am planning on doing is bringing this information back and really looking at how do we strengthen. So I would say to someone coming to me, I'm right there with you. Let's share ideas. Let's create some communities of practice. Let's do what we can so that we can collectively lift each other up. And there was a woman on the panel, Lorraine. Is there?
Yes, she's here.
Okay. You said a lot of things that were inspiring to me. One of the things that you said was, how do we create a movement? Okay, I'm a public sector. I've already given you the constraints around some of those pieces. However, how do we set a tone for what we'd like to see moving forward more intentionally? Because we can have X number of states and X number of states doing X number of things, and there was someone who talked about equity earlier. When you have differences in how things are being applied and no consistency, then it runs the risk of it working better. When I lived in New York, people would come to New York for services because they would receive more services than they would in their respective states. But what if we were to collectively create a floor? What would that look like? And so I'm putting myself out there. I'm very interested in meeting with like minds and doing more than talking about it, because we talk about these things for nauseam sometimes, but let's grow some wings.
I love that. Love that. And here for everyone who's either working on this issue from a policy or research perspective, here you have a leader doing this work in a state who just gave you an open invitation to collaborate in addressing these issues. So please take that to heart. I want to open it up for 1 or 2 questions in the last 3 minutes that we have. Oh, we have 10 minutes. Oh, excellent. Okay.
If I may, Jason, we have a question for one. So I will use the microphone. Okay, so this is about the AmeriCorps comment that came up earlier. The National Community Care Corps is a federally funded program that explores best practices to use volunteers to support older adults, as well as adults with disabilities and family caregivers. This program has more than 5 years of data and could be expanded. Thoughts?
This is, that's just the type of thing that you find when you pull on a little thread. Right? So if you were to ask me, what could you do tomorrow? Go back to your community and start an inventory. And don't just Google, caregiving, elder care, disability, whatever. Just think about, just really go outside the box. Do an inventory of all the possible resources in your community that could be tapped, and then take a step back. And you can pull it back, but you always go for the jugular first, and then you pull yourself back. Because I do think pulling on those threads, it gives you a different sense of what's possible.
I would just add, I think that Community Care Corps is a great example of an idea that was developed over many, many years under the leadership of, at the time, Representative Michelle Lujan Grisham, now Governor of New Mexico, over the course of maybe 15 years, and is one of the most underfunded promising practices in supporting and building bridges between communities and addressing our care crisis. I think the funding level is about $5 million. $5 million in the federal budget of trillions of dollars going to support these issues. That's a great example of leveraging that evidence to understand this is something that's worth investing in and scaling.
Okay, so again, so out of character for me, but I think like Tuesdays and Thursdays, I'm an optimist. So one way to think about this is, if you've got the model and the vehicle, now you can turn to other sources of financing. Go to your, Chamber of Commerce, go to the philanthropists in your area who may themselves be aging and or be caregiving, and spark that movement locally.
Yeah, absolutely. Public-private partnerships, another key tool in the toolbox. Any other questions?
There a country on the face of the planet where I understand that, political structure and the government structure, the history could be different, but where you feel like the regulations and the practices are working pretty good? Could it be Switzerland? Could it be any of the Nordic nations?
Can I take a sec?
Yeah, okay.
So I would encourage, I don't know, has anyone here seen the film Human Forever? All right, so watch Human Forever. A young nurse from, I think he's gonna bring my neck, Sweden. His name was Toon, and he went to 8 different continents and looked at 12 different countries in those continents and how they were providing care and what that looked like. And that there are best practices in all of them. And that if you're really wanting to create the perfect package, maybe looking at the experience and what's been learned from practices that are very old to newer and putting those together. But he's been working on that, and it's a documentary that you can find. It's very interesting.
Okay. So last summer I spent 2 weeks in Finland and visiting some friends, like parent age friends, and went around and visited aging systems as well. And I can't speak outside of anecdotes because I obviously haven't done a real scan. However, in visiting the homes that I visited, the workers were, because I asked them, like, how long have you been in your position? How are you enjoying it? And they were a lot more satisfied with their jobs in Finland than what I've done anecdotally. In relation to some of the challenges that we hear about happening here. The other thing I wanted to share I shared some of the demographic shifts that we're seeing as in our country. Oregon is already over that sort of, the scale is already tipped more people 65 and over versus 18 and under. And I said, well, tell me about the demographics here. How are things going there? And they're on the same trajectory as us. And so it seems like there's some opportunities there. And then I want to get to another thing that you said. I was blown away by this socialist system where everyone gets services. And I said, what do they have to pay?
Nothing.
Well,
taxes.
Taxes.
The highest taxes in the world.
Yeah, they do. And
5 million people in Finland. Just think about it.
yes, and no, I'm not saying this as a blow. I'm just saying that it's something very powerful when you can age and not worry about the finances, because then that's where you see sort of the accumulation of all of the disadvantages that many of our communities have confronted. And those disparities become greater as you age in this country. So you give me a system that everyone, like, again, talking about floor, everyone can get in on that floor and boogie, right? I'm not mad at that.
Absolutely. I think it's clear. I mean, one of the truths, the fundamental truths about this issue is that caregiving is part of the human experience. It's not unique to America, right? Everywhere around the globe, people are caring for one another. The pain that caregivers and direct care workers feel in the US is a result not of our economy, but political decisions that we've made as a country. And there are other countries making different decisions. Finland, the UK, Ireland, you name it. There's a great organization called the International Association of Care Organizations, IACO, that has compiled a list of promising practices across different governments. I don't think it's something that, there's not one example of one system that's doing everything perfectly, but that's never the case with any policy issue. It's about what are the levers that we can pull, but whether it's paid family and medical leave, compensation for direct care workers. And in Ireland, there was a movement to integrate carers into the constitution. There's a great examples of opportunities to do better for caregivers and direct care workers that we should take from other countries and think about fundamentally here. Any other questions? I see maybe Dr. Wolf has a comment or question.
Yeah, just in the spirit of ending on a positive note and what can we do tomorrow? And I wanted to just comment that in my own community, there's an organization that I know nothing about, but that I think exists in other locations called Partners in Care. It's a nonprofit organization, helps older adults live independently at home through a unique service exchange model where members volunteer, trying to help each other with tasks like transportation, handyman work, social support, earning credits. And I thought about like, this is an organization maybe I should learn more about, but it exists in my community. It might exist in rural communities. And I just wanted to end on a positive note that this is something that exists and there are, little pockets of excellence all around, and figuring out how do we take these and scale them. I'm not plugging this organization, but just, that there is a reason for optimism, sort of getting back to that idea of local communities and villages supporting each other.
Just add a philosophical note. I was just reading in the New York Times today a study showing that there's a lot more religious affiliation among young American men than there has been of late. We won't talk about the women, but it goes back to commentaries that I've been seeing for many years now about how Americans increasingly feel disconnected, untethered from their community, isolated. Nothing about social media or devices help with that, and that there is this void. I say leverage that. Offer them a way to fill the void, because that void is hurting all of us, especially in the caregiving space. And it's, I know it feels like a long road, but culture change usually starts that way. It usually starts out feeling quite far away. But if there's this hunger, and we know it, it's been documented, there's data on it. And, right now they're fulfilling that with church going, but there could be other ways for them to get reconnected and rebuild that village.
That's great. I love that. Great way to end the conversation. I agree. And I used this earlier, there are these resources that exist in every community. I think it's about looking them up. And I wouldn't even worry about scaling them. I just worry about supporting them. Like, what can you do today, tomorrow? Scale will happen through conversations like these. And so thank you all for being part of the conversation, especially to the panelists who are doing amazing work in all different parts of this ecosystem to create this bridge between family caregivers and direct care workers, and to truly value care in this country. So thank you for your